Hey there, I'm here with Dr. Laura Andreson, who is running for the Tennessee House of Representatives. She's also an OBGYN who's been practicing here in Tennessee for about 7 years and overall for 22 years. She is running for the Tennessee House of Representatives specifically to raise awareness for reproductive freedom. Dr. Laura Andreson, thank you so much for being here. Go ahead and please tell the audience a little bit about your story and where you come from, and also when you first heard Roe was overturned, how that affected you as a doctor.
Yes, thank you. I initially became aware of Roe falling when it was leaked and when the Supreme Court leaked it, and was hoping that maybe that was false information. The day that it happened, I remember exactly where I was, what I was doing, and had full realization this would immediately affect my patients, my colleagues, myself drastically. The inability to provide someone with standard of care health care is a really strange place to be in as a physician. I originally grew up in North Dakota. I did my medical training in Des Moines, Iowa, and Minneapolis, Minnesota. I practiced there for a few years and then decided to move back to home to North Dakota. We were there about 5 years and then relocated to Tennessee. I'm in a small practice in Franklin, and I love my job. I truly do. But the last 2 years, it has been tremendously more difficult to take care of my patients without fear of criminalization.
And speaking of your job specifically, what does your job entail?
So I'm a general obstetrician and gynecologist. So that means I take care of women of all ages. And one of the problems with the abortion laws that are here in Tennessee is that it affects my ability to take care of women that are reproductive age. They are unable to get care that I've been trained to receive in a state where their loved ones are, where their home is, where their family is. And that just creates a lot of barriers for families and for patients that aren't necessary. There's not really room in a relationship between a physician and a patient for politics.
Can you tell some stories? I know we often talk about the dangers of pregnancy and how things can go wrong. You also perform surgeries, is that correct, to give your patients when giving birth? Do you mind talking about some of the procedures you've had to perform, and also maybe some of the stories where things have gone wrong and you've had to save your patient's life?
So pregnancy is a very, I'll say, hazardous time in a woman's life. Your volume of blood in your body doubles, so that puts a lot of strain on your heart and your kidneys. So if you have any underlying conditions such as diabetes, hypertension, or heart disease, pregnancy can be exceedingly dangerous to you. It also puts a burden on the body to be able to handle the stressors of pregnancy in each trimester. Significant bleeding or infection risks are present throughout all trimesters of pregnancy. So I've had situations where I've been able to care for women in the emergency room that come in hemorrhaging from an ectopic pregnancy that's ruptured or a miscarriage that's happening. And sometimes in those situations, the baby still has a heartbeat. And that leads to me performing an abortion because, by definition, that is what it is. You're ending the pregnancy. And that just is an unbearable situation to be in. But you have to do what's right. The second trimester, you can say the same kind of things. And then as we get closer to delivery, there's a lot of health complications that can come up. Women oftentimes will develop a condition called preeclampsia, and that is when their blood pressure goes up and it starts to affect all the organs in their body. And that is exceedingly dangerous. We can see blood pressure ranges where women have strokes. I've seen women lose their vision. I've seen complete renal failure. Really significant things can happen. So pregnancy is definitely not a danger-free zone. Yes, women were made to have babies and they're able to do so, but it's not without significant possibility of very real tragedies. One instance I just had this week, so it's very fresh in my memory. I had a patient, I knew she had a history of postpartum hemorrhage. I did a routine C-section on her. Things went well. There was a little more blood loss because it was a between pregnancy, so there was a little more bleeding than I would have anticipated. But shortly after the surgery, she kept bleeding and it wasn't stopping. I tried a couple of different medications, tried different techniques that we have to treat this, and then ultimately was able to put a device into the uterus to put suction on it so it would stop the bleeding. This woman in that amount of time lost 1/3 of her blood volume. And had I not acted quickly and my team had not been efficient, she's in very real danger of losing her life. If you have significant enough blood loss, you can go into shock and you'll shut down your kidneys. It'll affect your heart, your lungs, everything in your body. So there's multiple situations that have occurred throughout my career that put the fear of God in me. I mean, we're very lucky that a lot of these women are young and healthy and they can survive these situations. And a lot of times it is just luck. Our maternal morbidity and mortality in Tennessee is horrific. You can look at different reports and they'll give you different numbers, but we're for sure in the top 5. And in 2021, 134 women died in Tennessee. And that was twice the number of what we'd seen from 17 to 20. Big reason for that was COVID, but also substance use disorders, mental health issues, cardiovascular disease, all contributed to that. And the most affected areas are rural areas, or the west side of the state is very affected. But our rural areas, as hospitals have closed, women oftentimes will drive 2 hours or more for obstetrical care. And so if you have someone that has underlying disease, they couldn't see a doctor regularly because they don't have insurance because we haven't expanded Medicaid.
Mm-hmm.
And then they become pregnant and it becomes a life-threatening condition for them. And in some situations, those women are going to want to continue those pregnancies, but in some, they may decide that they can't. And here again we can't offer them the care they need because we're in a banned state.
I often talk to a lot of anti-choice folks who are saying, well, it no longer becomes your body when you become pregnant. Can you speak as a doctor, your thoughts about that and how that actually is not true?
Every person, every woman that is of reproductive age should have the right to choose what to do with her body. It is a very real commitment to have a child. There's big financial concerns. There's health concerns. There's money concerns. So to say that woman no longer has a right because she got pregnant is really catastrophic. One, there could be a failure of contraception. There could be rape. There could be incest. There's been studies done that show most women that present for abortions have families, and they know that additional child will affect the remainder of their family. So they've made that hard decision. As a woman, you have a choice to decide whether or not you want to continue that pregnancy if it's best for you, because it's your life, and that decision can affect you for the rest of your life. Your education level, your income level, your partner choice, they all add up. And I just think it's really a bad precedence to set, to tell one half of the population they shouldn't get to decide what to do with their body. And that's what they've done. And I think women are mad. I think a lot of us want to have the ability to make that decision. We're smart. They can trust us.
Going back to what you're saying about hospitals closing, so since Roe has overturned, I know there's a lot of clinics that have had to close. And you say specifically rural areas are very affected by this because some women have to drive up to 2 hours, maybe more, to get the care they need in state. That's the women that could afford to, and also the women that could maybe not afford to fly out of state or couldn't get an appointment at a clinic out of state where it is legal because there's extremely long waiting lists. Have you experienced seeing OBGYNs flee the state as they're saying that they are, and that's why these hospitals and clinics are also closing?
I don't know that that's the entire reason. I think Medicaid funding has a lot to do with that. And Medicaid funding is not ideal, but it is something. The reason it's not ideal is that reimbursement is not great for the hospitals or the physicians, but it at least gives patients something. And that is a factor, but we have seen physicians leave the state. we've seen a lot of specialists leave. Maternal fetal medicine are the doctors that deal with high-risk pregnancies or pregnancies that have had a complication. And I know of at least 3 personally that left because they didn't feel safe practicing here and just felt like they had a target on their back. And the residency applications this year for OBGYN programs in Tennessee was down 20%. So not only are we losing doctors, but we are not getting new ones. And there's already a huge shortage of physicians in this state. And it's going to worsen over the next decade as people retire and decide they may want to live elsewhere if things don't get better.
As an OBGYN who's had to face difficult decisions, especially as Roe has been overturned and Tennessee has enacted one of the most extreme abortion bans in the country, do you fear for your career as you're treating your patients?
I don't have as much fear now as I did before the legislative session in 23. There was a period of time between August 25th and July of 23 where we could have been charged with a Class C felony for treating an ectopic pregnancy, which is not in the uterus, which cannot be reimplanted. It will result in the death of the woman if not treated appropriately. So there were multiple cases where I just questioned why I was being put in this situation. I'm choosing between someone's life and criminal charges, losing everything. I mean, Class C felony, I would go to prison. I would lose my license. I would lose all my accreditation with insurance companies, probably lose my privileges at my hospital. It's a big deal to get a felony as a physician. So I was terrified. So I actually retained a criminal justice attorney because this is a criminal offense. It's not malpractice.
Right.
And my malpractice attorneys weren't touching it. So they actually told me when I spoke to them, good luck. Which I was like, okay.
It's not what you want to hear.
No, I'm like, okay, thanks.
Yeah.
Good talk. But yeah, I just took money out of my own savings to put someone on retainer so I could have the language to chart to protect me. That was the only thing I could do to protect myself, because our big organizations that I would normally expect to protect us weren't there. ACOG didn't want to comment on states that have bans because it's not standard of care to not provide a medical procedure to end a pregnancy, an abortion. And other organizations that I thought would have stepped up weren't doing it at state level. So it was a very isolating time. And then patients came in almost daily. I'm pregnant. I'm scared something's going to happen. But are you going to let me die? And they're scared. They're not gaslighting me, as it's so often said that we're gaslighting people about this. It's like, no, these are real patient concerns. These are real physician concerns. There's patients that said, I don't think I feel safe getting pregnant in Tennessee, so I'm delaying my family planning. I mean, just lots of unintended consequences. And then to see what they're doing now with not protecting IVF and contraception.
I was about to ask you about that. Yeah. Moving on to, how, I guess if you just want to
so
go on to that, how you feel about, as an OBGYN, them coming in, taking away contraception, the right to IVF, the right to create life.
Yes.
When you are ready to create life.
Yes.
Yeah.
I mean, it's ridiculous. And there are no laws preventing it at this given moment. But we also didn't think Roe was going to fall, right? Nobody thought it was going to happen. And it did. So I have no trust in that statement. It was quite evident to me. One of my colleagues and I went to the Capitol the day they had the hearing on the contraceptive and IVF protection laws. And we met with the chair of the committee, and she spoke down to us like you would not believe. She told me her husband was a physician and he's not having any trouble getting contraception for his patients. I don't think he's going to be too late.
I was going to say, yeah.
and we were just gaslighting and making problems and making patients scared when they don't need to be. And it was very demoralizing and rude. And
you have 22 years of experience in this.
And I'm saying, this is what my patients are saying. Did you see what just happened in Alabama 3 weeks ago? And she said, well, we're not Alabama, we're Tennessee. And she said that when she started the meeting too. So you just see what you're dealing with. Like, these people don't want to see the other side of the coin. And to not protect those things, you're immediately putting them in danger, in my opinion. Same thing when it happened at a national level. Why don't you want to protect it? You could at least let women sigh a little bit of relief with knowing, okay, at least I can prevent pregnancy. I can't, if something happens and I didn't want to be pregnant, I can't do anything about that, but at least I can try to do the right thing. And now we're going to try to take that away. And then IVF, because they believe that life begins when the sperm penetrates the egg, which is a very much theological belief, because the Jewish religion believes that life begins with the first breath.
Right.
So that in itself is in our law. And so that, I've always thought, well, why isn't that affecting our IVF clinics? And when is it going to affect them? And that's the ground they are going to go after next. Because those are all babies. They're 5-day embryos. They can't survive outside of a woman with a uterus. So it's just been really interesting.
Wow. Thank you. You're answering everything. And it's also giving me a lot to think about as well. Because, as a woman who is in a relationship and, people often think because I am pro-choice that I don't want a family, but I would maybe like one day, but I'm still younger than 30 and I'm not sure when that will happen. And my mom was 40 years old when she had me and I was her only child. So it's possible to have children later, but I know a lot of people can't have that without IVF. They can't have that. And you can't have the choice without being able to choose for yourself when it comes to contraception and
Right.
all of these issues. And then obviously, as you said, contraception fails. And then where you left to where you left, basically.
Yeah.
So I guess moving forward, as you're running for the Tennessee House of Representatives, what is your platform? What are you planning to bring to the Tennessee House of Representatives and to represent your constituents and their concerns, especially when it comes to reproductive freedom?
I think my most important role there will be to educate. I think even overall, even during my campaign, one of my big jobs is to educate people that I believe the word abortion has been weaponized. It is a medical procedure. And there's lots of morality and even the commonly used language, which I've used my whole career until recently, such as an elective abortion or abortion on demand. You would never say, I'm having a knee replacement on demand.
Right.
But we use all these judgment morality clauses when we speak about abortion. I spent a large time of my career not saying the word. I'd say termination, end the pregnancy, procedure, anything to avoid it, because it had become such a triggering word. We were taught to avoid it, and it was uncomfortable. So a lot of times I would avoid it just because of that.
Even for pro-choice, my mom was always like, oh, don't say abortion. And she marched for abortion rights, reproductive freedom in the 70s. So because it has been so weaponized, and nothing obviously against my mom, but that's how it has become.
Yes.
So I think the more that we say abortion,
Yes.
Unfortunately, because of the political limits through Meta, which is Instagram and Facebook, we are not allowed to say the word abortion. We have to censor things. We have to censor words. If you look at any of my content, I'm censoring even the word political. It's become so out of hand, but that's kind of the point. They're trying to make it that way, where it is, a weaponized word. And I never got to tell you this, but when I first released my song Barefoot and Pregnant, it started going viral, and Live Action, which is one of the biggest anti-choice organizations out there, was using it as a weapon, saying that I was saying that, I'm anti-family, that, being a mother shouldn't be someone's choice, like just completely twisting my message. And obviously that's not what I'm saying. I'm saying if you want to be a mother, if you want to be barefoot and pregnant and down on the farm, that's great.
Yeah.
That's your choice. Yeah. But this is it. That's the point. It's all about choice. So when you have big organizations like this, and I only expect it, unfortunately, to get worse, that are coming and twisting people's messages. As a doctor, you have been gaslit, as you said. What is your advice to other doctors now, other OBGYNs who are facing this issue and are scared for their own their own careers, their families. I guess, what would be your advice to them moving forward with all of these bans and everything that unfortunately seems to continue to be unraveling?
Yes. I think that just telling people that it's okay to speak out. It's okay to be loud about this because it is a slippery slope that we're on. And if everyone stays quiet, nothing's going to change. If they lost every obstetrician in the state, they would be in trouble. But they don't seem to care. Like, at least they don't appear to when we speak to them. So I would just say, advocate for yourself, advocate for your patients. And that will move the needle, hopefully. And I think there's something about that too, in that when I spoke about it being lonely in those months where it was so volatile and so much unknown, it's still very much unknown. There's a lot of gray in this law, and purposefully.
Of course, yeah.
But I've seen some resistance even among OBs in the community for wanting us to advocate with our medical association. There's been male OBs that are older that just think we shouldn't, again, don't talk about it, it's not happening. But then it's also interesting in that same circle, I can tell you I've met multiple people who have said, well, I knew about the law, but it was uncomfortable to talk about it, so we didn't. But now you won't believe this, my niece had a trisomy and had to go out of state for an abortion. And every time I hear that, I mean, everything's rare until it happens to you.
Right.
And why don't you think about the other people that it could happen to? Why don't you care about others enough to step back a little bit? I mean, I've always been pro-choice, and I've never been shy about saying that. But the anti-abortion folks are just really intense, and they're very powerful.
Yes, they are. And thinking that an embryo, a fetus, has basically more rights than the pregnant person carrying it is a big part of what they argue. And the live action folks were arguing that well, abortion is really cruel. It's obviously it's murder. It's all these fear mongering things that they use to scare people. And I think as we know, what's really scary is people, women that are we're going back to the age where women did lose their lives during childbirth. And I mean, we have one of the highest maternal mortality rates, as you said, and probably one of the highest teen pregnancy rates, at least for a first world country. I know that about America. So
because we only do anti-abstinence.
Right.
Or I'm sorry, abstinence teaching only.
Yeah.
We won't talk about the human body or how reproduction works.
Not like in France where they're like, okay, they teach you about sex, and it's not a taboo subject. So
it's a crazy world to be living in. So even going back to, like RBG would always say, women should have the right to choose when they start their families. And we had that in place for many years. I mean, I'm a perfect example of it. I was in school for 12 years to complete my medical training.
Right.
I did not feel that having a baby during that time would be beneficial for the baby or myself.
Right.
And so I diligently used contraception, and fortunately, I did not get pregnant. I always think I don't know what I would have done had I been in a situation. I don't think anyone can tell anyone what their choice would be in that moment in time. Even these radical people, handed this situation, what would you do?
Yeah.
Because you don't want to think about that. Because one, unplanned pregnancy, okay, this would totally alter the trajectory of my life. That isn't going to be beneficial for anyone. And if I'm 6 weeks along, there is not cardiac activity. There is a flutter there, but the heart is not formed until 10 weeks. And most abortions are happening in that 6 to 13 week window of time. Probably 90+%. It is 1% that are happening after 20 weeks. And it's usually because it's a severe fetal anomaly that can't survive outside of the uterus, or the mother's maternal health conditions are not conducive to continuing pregnancy. So all this talk about murder is just, again, it's fear-mongering. It's a judgment, it's morality issues, it's theology, and it makes women feel like, again, it's minimizing us, it's controlling us. And that's all I see all over these agendas from reproductive rights to a lot of the other issues. It's not about the children, because they've proven over and over they don't care about the children once they're born. Because if you get pregnant and you carry that child, well, then you're just a lazy person that they probably use other words to describe that you're on welfare and you're not contributing to society. Well, you put her in that situation by not letting her have the choice.
Right. And there's no benefits, especially in the states where abortion is banned, for these, families, these mothers that are having children against their will, that aren't physically, financially, emotionally capable of having children. And I also wanted to ask you, because I did have a friend who, she had an ectopic pregnancy, and she had to go in front of a board with very little time they had to decide whether or not she could have an emergency abortion. They did decide, but because they waited too long, she lost a fallopian tube and her fertility was damaged. And these are true stories. I hear it all the time from people on social media. For these boards, do you know anything about them? Are they politicians? Are they doctors?
So the window of time between August 25th and July of 23 and July of that year, between August of 22 and July of 23, we did not have in our law that it was clear we could treat ectopic pregnancies, miscarriages, molar pregnancies, which are pregnancies that can turn into a cancer.
Right.
So a lot of times we would phone a friend, ask a colleague, ask someone that's a higher level specialist than you, go to your OB director in your hospital. And some of the hospitals did form committees so that they could have more of an organized process, typically consisting of physicians, legal, to try to get these patients taken care of without the physicians being criminalized.
Wow.
And that still goes on to some extent in some situations. Some of the bigger institutions in Tennessee have been able to form policy and protocol for situations like hemorrhaging before viability, premature rupture of membranes before viability, so that these patients are able to be treated in an expedited fashion. So there's a policy in place, and that gives you a lot of protection. When the hospital's backing you, legal has reviewed this, you automatically have that to go off of.
Yeah.
It's not 100% foolproof, but it's a lot more than just me calling a partner and saying, hey, do you agree with this plan?
Right.
Because that's what I do at my hospital. And it makes you uneasy. I mean, there was a time where I was like, well, then two of us go down instead of one, but it's what's been adopted at our hospital. And hopefully over time it will be adopted statewide, that we have policies and procedures for these patients. Because we had one not horribly long ago that was like 16 or 17 weeks and her water broke. Within 6 hours, she was septic. Had my partner not proceeded, she could have lost her life.
Yeah.
And so it's just a really altered universe it feels like we're living in.
I think that was the majority of my questions. Is there anything that you would like to add to that? I definitely wanted, and then the whole bodily autonomy, where it's still your body even when you become pregnant.
Yes.
An embryo, fetus. I think a lot of people confuse that clearly with being a fully formed, developed, living, breathing baby. When that's not the case,
yes.
Correct?
Yes.
Yeah. So, I mean, could you talk a little bit about that? Because you have a medical degree.
Yes.
You know the difference between embryo, fetus, and an actual baby. So
up to 10 weeks, it is an embryo, and that is what's stored in IVF clinics. They're just a much earlier stage. And once we hit 10 weeks, the baby does have a functioning cardiac activity. After that, it is a fetus. And it's a fetus until it is born. I think, too, one of the things that's important to address also, besides that the fetus cannot survive outside of the woman's body until 22 to 24 weeks. 22 to 24 weeks, those babies are going to have about a 50% mortality rate, and their long-term health issues are significant. Cerebral palsy, sight issues, hearing issues, just long-term health.
that's since they're put into an incubator.
And kept alive with some pretty significant measures.
Because that's what they always say. Well, they could stay alive in an incubator, but women are not incubators. We're human beings. So that's a big point to make as well.
Yes. And like I said before, less than 1% of abortions happen after 20 weeks. So yes, you could deliver a baby at 22 weeks. They could keep it alive in the NICU, maybe 50% chance. And just the issues with that are tremendous too. We've seen that there's more babies being delivered with anomalies, which like acrania or anencephaly, where there's either not formation of the skull or there's not formation of the brain. And sometimes those babies can survive for a period of time with augmented help. A lot of places choose to just do palliative care, where you keep the baby comfortable and it passes naturally. But in some cases, people are trying to keep them alive, and we're seeing a lot more of that in our bigger hospitals in the state. More babies born with heart conditions. We're just naturally going to see more and more children with problems in our NICUs, and that's, I don't know how financially responsible that is. And again, the patients that want to continue a pregnancy, want to carry the baby to term, I have all the empathy in the world, and I will care for them as I would care for anyone else. I'm not promoting abortions.
I don't think anyone is like, yippee, I'm going to get an abortion today. I don't think anybody's skipping to the abortion clinic. I think what people don't understand is it's a huge decision, and it's not made lightly. Like a lot of anti-choice people that I've talked to are like, well, I don't like it being used for birth control. And I like to say, well, we have, like you said, one of the highest maternal mortality rates for first world country, one of the highest teen pregnancy rates. Our sex education is failing, if it's even taught at all, to be honest, because a lot of parents opt out of teaching, of letting children learn. And birth control fails, and some people are too sick, get too sick from birth control to go on it. So there's all these factors. And I think people think this is a very black and white issue. And I think one of the biggest things you were saying too is that to not develop empathy for women who are put in these positions, we have no idea what they're going through. It's not your body, so it shouldn't be your choice. And I think I tell people all the time, you have every right not to believe in abortion for yourself, but to force your beliefs on others, that's where the issue is.
That is my exact.
And like you said, abortion is not murder, it's healthcare. And you've proven wise, and you have a medical degree and 22 years of experience to prove that. So I would much rather listen to an OBGYN with an actual medical degree than a politician who's sitting there telling me what I can and can't do with my own body. Yes. So I'm so happy running. Thank you.
Thank you.
Yeah.
You know, they've done multiple studies on women that were too far along to get an abortion, or they were turned away for whatever reason. And there is significant changes in their trajectories of life. The other thing that I think is really important is to realize none of these decisions are simple. Kind of like you said, it's not like they're happy about going to the clinic. It's a big decision that takes a lot of thought, a lot of energy, probably a lot of tears.
Yeah.
But again, I just think trust women. They're very wise. You can let them handle this one. And one of the other big things that I struggle with is a lot of the misinformation about the abortions. Like you talked about murder. And then there's also the
post-birth abortion. Yeah, post-birth abortion up to 3 days.
Yeah.
I think one of our Republican candidate, Donald Trump, even said that in his debate, that you can have an abortion up to 3 days. That's murder.
That is murder.
Yeah.
It's not happening anywhere in the United States.
Yeah.
And people believe this. I had a patient the other day, she said, I heard you were running. And I said, yeah, I'm advocating for reproductive rights and gun safety and keeping our schools funded so we can continue to have public education. And she said, well, I'm a teacher, so I'm with you on those first two, but I really don't believe in those late abortions or after they're born. And so I just explained to her. So if you are carrying a baby that has anomalies, that it cannot survive outside of the womb, we will take care of that baby however you desire. A lot of times it's palliative care. It's like hospice care. You keep them comfortable, you let them have dignity, and you let their family spend time with them. And it's sad and it's beautiful at the same time. I've witnessed it many times. And that's what happens for those children. The children that are healthy and born, They go to foster homes and adoption.
And in a broken system that we have. Yeah,
because we're doing great with that.
Yeah.
So, I mean, to just say that over and over, just to build this case, and it's not reality. It's amazing to me that you don't have public service announcements out there, but I suppose you can't because you have to say the word abortion, and I'm just upset everyone's triggering.
Yeah.
But that one really drives me nuts. And then to have someone on a national debate stage say that, even though he's been trying to avoid that topic, supposedly.
How many lies has he said? Yeah. So actually, yes. So I just heard that there's some really huge anti-choice organizations that are actually by the Republican National Convention want Donald Trump to say wants a total abortion ban, does not want it just left up to the states. They want it on a federal level for all circumstances, even if a woman is going to pass away, just very extreme. And they said they will stop supporting him if he does not come out in favor of this total abortion ban. And I think he's going to be in quite a pickle, as I say, because he has to decide, because he knows abortion is a losing issue, because it's won in every single the abortion has won in every single ballot initiative that it's ever been placed on. Fortunately, in Tennessee, we have a law saying that citizens can't bring about a vote or have a ballot initiative added, unfortunately. But on a federal level, they could do it, pass legislation. But is our Tennessee supermajority going to do that? No. So I think that will be I think abortion is going to be a huge factor in this election, as we all know, but it's becoming really more it's becoming more and more apparent that is the case, and I hope women come through, and
I hope so too.
Yeah, vote in their best interests.
Yeah, we have such poor voter turnout. If everyone went out
in the country right now for voter turnout.
Oh.
Yeah,
but I think people gave up. Like, there weren't any Democrats on the ballot, and they just quit showing up. I mean, when I voted in the last election, the only person on my ballot was Joe Biden.
Yeah, wow.
Because I didn't have a school board or anybody else running at that moment in time. So I just thought that was part of what led up to me running, because just a series of events.
Yeah.
And with the funding, so Right to Life here in Tennessee is pretty active, and they have a lobbyist that is at the Capitol quite a bit.
I've seen him.
And he was I'm involved with the lawsuit against the state.
Yes.
So he was there too, just sitting in the back, lurking. But I saw him live in color redirect the entire bill that was brought forward to change the trigger ban law. He stood in the committee meeting and threatened to take their funding away.
I think I saw that. Yeah, I do believe I saw that through Tennessee Holler.
Yes.
Mm-hmm.
And then Sexton came down and reprimanded him, but the point was already made.
Yeah.
And that bill got significantly changed after he said that, because we had rape and incest in there, we had fatal fetal anomalies, and it got
anything that makes sense. Yeah.
And that bill was worked on by multiple specialty OBGYNs across the state, legal people, political organizations from both sides, and then they just came in and then they also had a really big machine to make phone calls to the legislators too, that smaller organizations don't have.
I talked to Senator Heidi Campbell, who has been a politician here in Tennessee since the 2010s, or 2010, I should say. And she said, well, maybe even actually before that, but she said in 2010, we didn't have this extreme Tennessee GOP supermajority where, it was a little bit more of, the Republicans and the Democrats working together. But because of voter suppression laws, gerrymandering, all of these things, and also, like you said, the Democrats have kind of just given up. Unfortunately, we are in the position we are in, but I do believe we can get it out. We can get Tennessee out of this really toxic place, and that's why I'm just so excited that people like you who know the facts and are actually doing the work can like you said, educate people. So, and can you remind people where exactly you were running so that they can vote for you?
I'm in House District 63. It's in Williamson County. It entails part of Nolensville, part of Franklin, a little bit of Thompson Station, and some of Brentwood. So I'm hoping that I can get people out to vote and make a difference. Because I agree too. I think there's a lot of room in the middle. And I think there are some Republicans currently in office that would like to meet in the middle, but there's so much pressure that they just, I guess they can't. But there's others who are down there that don't want to listen to the people. They just want to go with their conscience, which to me means their money.
Right. Wherever the money is, it seems to be. I guess the last question I'll have for you is, do you mind talking a little bit about the lawsuit you're a part of, or what it entails? And then also, my friend Allie Phillips, you know, is also on that lawsuit. And for those of you who don't know, Allie Phillips was pregnant and had a child, or was pregnant with a child that would have had a fetal anomaly. And she had to go all the way to New York because she was denied a medical abortion here in Tennessee. So I think she almost lost her life, I believe, up in New York, because her daughter actually passed away inside of her. So you are on this lawsuit with Allie Phillips. And
so
go ahead.
There are 7 patient plaintiffs and 2 physician plaintiffs. And it is through the Center for Reproductive Rights. They're out of New York City. And they gathered everyone's stories and brought this lawsuit against the state of Tennessee. We had the hearing on April 4th, and still nothing has come forward.
Really?
Was really hoping after the Texas one came forward, maybe we would get a little something, but we have not.
Wasn't that the Texas one shot down by the Texas Supreme Court? Yeah, I remember seeing that, and just there were OBGYNs just in tears because it's just the cruelty that these women are going through and will continue to go through as these bans are enacted. So it's very similar kind of lawsuits to that.
It is very similar. Tennessee, Idaho, Texas, I would say are the top 3 worst states for bans. And so a lot of similar laws here. But the lawsuit was intended to, one, take a lot of the gray out of this. Like, let's give us some guidelines to say it's safe to treat this or this. This you're not going to be able to ever take. You're never going to be able to do abortion on demand. But give us some room to move a little bit. And then they also, there's some constitutionality to it because you're taking away autonomy from half the population. So I'm hoping maybe we could get good news from it. It's a 3-panel judge, There's one from each portion of the state. So Eastern, Western, and Middle Tennessee. They call it a Chancery Court. And, I kind of thought it was going to happen when everything else was happening with the mifepristone lawsuit and the EMTALA lawsuit, which the mifepristone lawsuit, initially I was so happy. Can't believe they are going to let us have this. But then I found out it's just
left to the states again.
Yeah. And then also they're going to get somebody else to come forward with a lawsuit that has standing. I mean, this was a dentist and other doctors that didn't do abortion.
Someone who knows more, and what they're really banking on is Donald Trump becoming president again. Mm-hmm. So.
And then with the EMTALA case, I mean, that was huge. They could have given every banned state the liberty to care for these patients in our ERs, and they did not.
So they said no.
They said no. They gave it back to Idaho. Idaho can do it right now, but Idaho's been in a world of hurt. They've lost a tremendous amount of doctors. They were transporting people out of the state at $29,000 a pop on helicopters. I mean, this is not financially responsible. You want to talk about crazy spending of money, taxpayers' money. It's not normal or good.
It's another way to keep women barefoot and pregnant. Well, thank you for the work you're doing, and I'm excited for your campaign, and obviously I'm advocating for you. And if you're in Dr. Laura Andreson's district, please learn more about her campaign and her platform. And I know you're probably going to have a few events you'll be at, correct? So you'll keep seeing her face, and please come up and talk to her, ask her questions. She's so knowledgeable, way more knowledgeable than any other politician I know that doesn't have a medical degree. So thank you for running. I think it's so important more people who know what they're talking about do run, especially doctors.
Yes.
Yeah.
Thank you.
Of course.